we've been fortunate over the past decade or so that there's really been an exponential growth in the volume and variety of cardiac data that are captured specifically in the realm of congenital heart disease. And this has spanned different clinical registries, the electronic health record, different research data sets, billing data or charge data that are sometimes captured, and then the ever expanding set of genetic and biomarker information, and then different things captured on a variety of devices and monitors. But despite all that, the question has been really raised about impact, and are we able to effectively use all of these data to both drive scientific discovery and improvements in care for our patients, because that's really should be the whole purpose of why we're collecting it or utilizing it. And I think historically, unfortunately, the answer has been in many cases no, that we haven't been perhaps quite as efficient or effective as we would have liked to have been. And one of the major reasons for that is that our historic setup tend to consist of a variety of disconnected efforts, disconnected sort of individual silos, where everyone was kind of collecting kind of maybe a little piece of the puzzle or some of the data that mattered to them. But different entities and efforts weren't necessarily communicating kind of back and forth or sharing data perhaps as effectively as you might think. And this siloed approach really led to many inefficiencies and limitations. So first was the very high cost of doing research studies in our field because of all the redundancies in collecting and maintaining and regulating and analyzing all of this redundant and disconnected information. Second was limited science or discovery, in that the lack of integration across our data sources oftentimes limited the types of questions that we were able to answer, because we were only just seeing kind of one little piece of the pie, and our ability to move beyond short-term or in-hospital outcomes, really to understanding what's most important and issues that span, multiple episodes of care across the lifespan. There was also limited translation of new scientific findings to tangible improvements in care. And this was because historically there's been a poor connection between research efforts in science and then how we translate that to actual improvement or changes in the way we provide care at the bedside. And then few solutions, because there was little collaboration, again, across all these efforts and across disciplines or networks to really think outside of the box and design some novel ways to kind of address these challenges. So that's really where Cardiac Networks United came in, which is what I'm going to talk to you about, for the last few minutes of the slides here. This organization was formed in 2017 after a series of different stakeholder meetings that really got together individuals across the field with an interest in this area, including the leadership of our different heart centers, the National Heart, Lung, and Blood Institute from the NIH, different professional societies, parents and patients, many of the CHD foundations, and then quality improvement and research experts. And what Cardiac Networks United did was to bring these 5 founding organizations that you see here together kind of under one umbrella to agree to collaborate and hope to accelerate our capabilities, both from the scientific side and from the improvement side, through joining forces, pooling our resources, and collaborating together instead of all operating completely independently and separately. And a lot of this, what we're going to be talking a lot about is the data side, but a lot of this really didn't have to do with data or the technical aspects. It really had to do with changing our mindset and changing our culture as organizations, as a field, and moving from some of how we operated historically, which was oftentimes in the sort of create and compete end of the spectrum, really to the more collaboration end of the spectrum, as you see here in this example of different aspects of organizational culture. And this really wasn't unique just to our field. This is an issue that spanned other fields as well. This is just an example from some of the cancer initiatives in an interview that was on NPR a few years ago, where the leader of one of these said the technology for sharing data has improved faster than our attitudes about sharing. And so that was certainly one barrier, in addition to some of the technical aspects that that thankfully has been overcome. So the current reach of Cardiac Networks United, again, spans these 5 different networks you see here, and maybe in the Q&A we can certainly talk more about the details and what each of them is working on, but spans multiple different phases of care, including out into the outpatient or follow-up setting rather than just the inpatient setting. It's certainly not limited to these 5 networks, but these were just the first few that took the plunge and wanted to collaborate. And since that time, we've been contacted by numerous others, and there are many other potential partners out there in terms of expanding our efforts that we're excited about. As Jessica mentioned, these networks represent more than 85 different children's hospitals across the US, or about 2/3 of all congenital heart programs. So a really broad reach in terms of participation. In addition to the kind of more traditional clinical information that these entities collect, there are also multiple ongoing sort of pilot projects amongst our member networks, and some of which that are also sort of under the Cardiac Networks umbrella, that are looking into integrating with these different emerging types of data sources that are really valuable as well. So different projects aiming to integrate with the electronic health record, integration with different research data sets, for example, from the Pediatric Heart Network, really tapping more into some of the unique data captured by devices and monitors. For example, all the different monitors that you see monitoring the minute by minute physiology and vital signs in the intensive care unit. Important data from even before birth, maternal fetal information that turns out to be probably really important in figuring out how kids with congenital heart disease do later on in life, genetics, biomarkers, and really the gamut of what you can think of, including information from different devices then in the longitudinal or home-based setting, such as different home monitoring systems. And then importantly to us as well, delving into different patient-reported outcomes and quality of life across the lifespan, which again is really the goal. In terms of how the infrastructure is set up that allows us to do this work, there's sort of 2 different cores that support the work. One is a data core that's really a partnership with data scientists that allows us to create shared and efficient tools to support everything we need to do from a data perspective. The goals are, again, to streamline our efforts, to collaborate, to optimize how we're able to use this data, and really to foster integration of the information that's there across all of the different networks, as well as not just the data, but the expertise. The second is an improvement core, which is a partnership with improvement science experts. And the goal of the improvement core is really to provide the specialized expertise that allows us to translate some of the research and science into tangible improvements for patients and their families. And I'm going to show you a couple examples of that in the next few minutes of how that works. So just to go over kind of a few things that we've accomplished just over the past year or so, over the course of 2019. One thing that's been really helpful is just getting everybody together in the same space across these networks to foster, sharing and collaboration and shared expertise. And so our first sort of joint meeting across the networks was held in Ann Arbor in November of this past year, with almost 600 people in attendance across all of the different networks, and really involved a lot of sharing of knowledge as well as sharing of educational opportunities across the network. So we planned and discussed integrated joint projects, and then provided training sessions as well for some of our trainees and junior investigators who wanted, say, training in quality improvement methods or things like that. So it allows us to provide some joint training as well. The second thing that was very exciting to us over this past year was our collaboration in efforts to launch the CNOC registry. So CNOC is the Cardiac Neurodevelopmental Outcomes Collaborative. And this group focused on launching the largest registry worldwide that now is collecting important neurodevelopmental follow-up information, with a goal of not just collecting that data, but using it to really optimize those important outcomes in our patient population. And a registry of this kind had not existed previously. So we were able to assist and collaborate with them and get them up and running fairly quickly. They were able to capitalize on all of the data that was already available through our network partners in Cardiac Networks United. For example, the baseline surgical information and diagnoses and information about the patient's condition, so that all they had to focus on collecting was their important piece of follow-up data. And this really accelerated, as I said, their sort of startup process. They didn't have to start from scratch, and also really reduce some of the costs associated with these registries, because we weren't collecting redundant information. We were able to capitalize on what was already there. And then to close with, I'll just mention two different actual projects that have been conducted using some of the core resources through Cardiac Networks United. So the first of these was a project that was co-led by two of our networks, PAC3 and PC4. And these groups were really interested in understanding and improving the way we provided care around the time for surgery for a variety of patients. And one of the first areas that they focused on seems relatively simple, but it turns out it has a really important impact. Is just how we were managing and taking care of chest tubes that kids have after surgery. Pretty much every child who has heart surgery has a chest tube that's placed to help drain off extra fluid that may be accumulating from around the time of surgery. And what they found out was that there was tremendous variability in how we were managing those tubes when they were coming out. And it turns out it's important because it impacts how long you're in the hospital, how much pain you're in, how quickly you recover, and all of those sorts of important outcomes. So this graph on the bottom is just an example of some of what they found out. So the height of the bars that you see here listed for a variety of different surgeries is how long typically different centers were keeping in their chest tubes. So you can see the height of the bars for every surgery that's listed there is tremendously variable. Some of them are really short, some of them are really long. And what they noticed was that there was one center that you can see in the orange in each little set of bars there that across the board seemed to be taking out their tubes much more quickly. This center had also a dramatically shorter length of stay and didn't seem to have any ill effects from doing this. So similar rates of having to put the tube back in or having to be readmitted to the hospital. So what this group was able to do was use that research and the information that they collected to then design a project to say, how can we improve this, and spread this practice across other hospitals so that it can have a positive impact for other patients and their families. So this information was presented at the American Heart Association this past year and actually received one of the top science awards there. And what you can see here, the yellow arrow shows when they kind of started their intervention. And through spreading this practice across multiple sites, they were able to reduce across the board the length of time these tubes were in, and also substantially reduce the length of stay that these kids had to spend in the hospital recovering after surgery. So pretty exciting results that sort of utilize both the merged data across different networks to make this study possible, as well as the shared expertise on the research side and on the improvement side to really spread this science and practice across hospitals and lead to a tangible improvement for our patients. This study, like I said, was primarily led by the PAC3 group and led by Dr. Katie Bates, who's one of our cardiologists in Ann Arbor. And then the last project I'll mention as another great example in this area has to do with preventing cardiac arrest. So obviously a pretty significant complication that can happen to kids hospitalized with cardiac disease, whether for a medical reason or around the time of surgery. And so this group of investigators, who's led by Jeffrey Elton, who's an intensivist in Cincinnati, was focused on how do we learn more about cardiac arrest and then take what we learn to reduce the rate of cardiac arrest across hospitals. So they use data from one of our partners from the PC4 registry to understand some of the science behind this, to say, well, who's at risk for cardiac arrest in the first place, and then to understand variation across hospitals. So to say who seems to have the highest rates and lowest rates of cardiac arrest, you can see some of the hospitals on the left there circled in blue who tended to have the lower rates of cardiac arrest. And then they said, what are these hospitals doing differently? How can we learn from these and other of the so-called top performers in this area who seem to have figured things out and seem to have a lower rate of this important complication? So they then took all of those things that they learned from the scientific perspective and collaborated with our improvement core to then say, all right, we have this information. How do we use this, again, similar to the last example, to really make a difference across hospitals and reduce the rate of cardiac arrest? So there was 15 hospitals participating in this initial project. This was, again, presented at the American Heart Association, and both of these studies hopefully will be published soon as well. But what they were able to show was, similar to the success I showed you from the last project, a substantial reduction, in this case, 33% reduction in the rate of cardiac arrest through, again, applying this knowledge and science across the hospitals and improving care for everybody from this research. So I think pretty exciting in terms of, some of the really concrete and tangible impact that these efforts can have on our patients and families. In terms of what we're working on next and some future directions, as I mentioned, this isn't an exclusive club by any means. It's not just open to these 5 networks, but we're open to collaboration certainly with others as well. And we've been approached by a number of other either existing or new networks that are potentially interested in joining forces with us as well. And so there's ongoing discussions with several, and you'll probably have more to announce over the coming year as to some new partners, which will be very exciting as well. From the research side, there are several different ongoing projects and then areas where we'd like to focus our attention on in the future. Certainly the concept again of longitudinal outcomes and really getting outside of just the hospital setting, but saying how can we make sure we're optimizing our approaches to really foster long-term survival and quality of life, and those important outcomes is an area that we'll be hopefully studying more. There's interesting projects and some preliminary work going on in terms of how to better leverage not just this typical clinical data we have, but as I mentioned, some of the really novel information about maternal and fetal factors, genetic factors, biomarkers, some of these other things that are out there now that we need to understand more and how they impact outcome for our patients. And then there's also some discussion and excitement around the potential to use some of our data and networks and infrastructure, not just for these types of projects, but as well as a platform that can be used to conduct clinical trials. And we've collaborated some of our networks with the Pediatric Heart Network on some of this work previously, and there are ongoing discussions about the potential to support a new trial in collaboration with them as well. And then on the improvement side, there's a lot of exciting work going on in a project led out of Stanford that's really building on some of the things we learned through the chest tube project and figuring out what do we need to do to further reduce length of stay for patients in the hospital. And there's still tremendous variability across hospitals. If you look for the same exact operation, someone may stay for a week at this place and stay for 2 weeks over here. And so why is that? So a lot of work in that aspect as well that'll be exciting over the next year. So I'll just close with this quote about data, which is one of my favorites. Data is not information. Information is not knowledge. Knowledge is not understanding, and understanding is not wisdom. And so I think it's really through not only leveraging and integrating our data, but also the wisdom to collaborate and share the information gained to affect change that really provides us the best opportunity to improve outcomes for patients and families impacted by heart disease. And so just want to acknowledge the Children's Heart Foundation for their tremendous support of our efforts, which just would not be possible at all without your support. So many thanks to the group and all of you here in attendance for taking the time to learn more about this area of research. And also thanks to the University of Michigan and Cincinnati Children's Hospital, who have supported these efforts as well.